Good morning and welcome to D.C. Today. I'm Del Walters in Washington. The White House saying no need to panic. Omicron, the word no one knows how to pronounce, is the word of the day. Some say Omicron, some say Omicron. You say tomato, I say tomato. But the bottom line is we have been here before. Think back to the first days of COVID, people checking into the hospital and then never checking out. Masks that worked and those that didn't. Enough hand sanitizer to fill an ocean, not enough bleach, it seemed, to go around. Then slowly we learned keeping our distance worked, mask worked, outdoor settings worked. That was before the vaccine, 3 of them, the pill, 2 of those, and steroids. The worst case scenario is that Omicron will spread like wildfire, just like the original COVID virus did, the first variant. The best case scenario is it may take 3 or more months to find another vaccine to fight it. In the meantime, we know what to do until then. And for that, we don't need the White House or politicians. We'll lean on the same doctors who got us this far. Dr. Reed Tuckson, Dr. Corey Hebert, Dr. Sophia Debin, and others. Mask up, vax up, wash your hands, and keep your distance. This is not your father's COVID crisis, nor is it the one from 2019. In the meantime, the president says that while we should worry about this new variant, there is no need to panic. It's been found, though, now in more than 15 countries, including Canada, and the UK is now reporting at least 4 cases there. It comes as a temporary travel ban to some South African countries have gone into effect, and that has led to some controversy. Our D.C. correspondent Bofta Yiman joins us live from our bureau on Capitol Hill. And Bofta, are we back in March of 2020?
Well, it certainly feels like it, Del. No doubt the world is on edge right now. And if you ask the White House, they'll likely say we are in a better position than in March of 2020. We have the vaccines. We're more equipped, with scientists looking into the risk factors of the new variant as well.
We have the best vaccine in the world, the best medicines, the best scientists, and we're learning more every single day. And we'll fight this variant with scientific and knowledgeable actions and speed, not chaos and confusion.
Still, there's so much we don't know. The World Health Organization, though, has warned that early evidence shows the global risk from Omicron is very high, leading to potential surges with severe consequences. And stocks and oil prices have fallen as Moderna's CEO announced that current vaccines will struggle with Omicron. Researchers in South Africa first identified the new variant, as we reported days ago. Effective yesterday, President Biden issued temporary travel bans to and from South Africa, along with a host of other African countries, including Botswana, Zimbabwe, Mozambique, and Malawi. President Biden also facing criticism from some foreign leaders and health experts for failing to send vaccines to poorer countries. But the White House administration pushed back on that, saying they've sent 13 million doses to South Africa and over 93 million doses to other nations across Africa. The White House points out that providing vaccines isn't always enough, adding that operational capacity and vaccine hesitancy are challenges that exist in many parts of the world, not just the United States. Now, the president is expected to release his strategic plan for mitigating the spread of Omicron on Thursday. It is not expected to include measures for a lockdown.
I think it's almost inevitable there will be, at some point, that strain here in the United States. But I don't think anyone's going to be reluctant to report.
Now, some have criticized the U.S., saying this is a discriminatory move against Africa, since the U.S. has not banned countries like Belgium, Germany, or Hong Kong, where there's also been reported cases. Airlines for America, an industry trade group, encouraged the U.S. government to make decisions regarding international travel restrictions to be rooted in science, as there are still many unknowns at this time. President Biden called the travel bans a precautionary measure until they have more information, and they may add more countries to the list. But for now, Del, what we do know is that Netherlands and Portugal, for example, who each have 13 reported cases, they have not experienced travel bans. So there is no question why this is raising eyebrows.
And Bofta, this is that intersection between an outgoing administration and the new administration, which is no longer new. This is the Biden administration's virus now, and they know it. It seems almost as if they're trying to make sure that they don't say what they said going into the July 4th weekend, which is that this virus is behind us. It almost seems like the White House is saying this virus is going to be with us, and we're going to have to live with it, and we're going to have to live with it for a long time.
Absolutely. And I think that this is probably the better side of messaging that we've seen with them, because they have put these self-imposed deadlines in the past, from Afghanistan to July 4th, as you mentioned, related to COVID, and it never worked for them. And so they're realizing maybe we should pump the brakes on that kind of messaging with firm deadlines and admit that this is something that we just don't know enough about. Scientists have to work on this. And what they are saying is that these travel bans, much to the objection of those in South Africa, they are saying that these travel bans really buy time. The question is, well, why aren't there travel bans to other countries then?
Bofta Yiman for us in our bureau on Capitol Hill. Bofta, as always, thank you very much. And while the Omicron variant becomes the new focus in the fight against COVID, some states and organizations are still fighting the vaccine mandates. Yesterday, the Supreme Court turned away a group of Massachusetts healthcare workers who wanted exemptions from their hospital's mandatory vaccine policy. So let's break it down now with some of the brightest minds in politics. The CEO and founder of Full Circle Strategies, Joteka Edie, joins us, as well as Timothy Allen Simon, who is the chair of the African American Chamber of Commerce. I want to begin with Oklahoma's governor, Kevin Stitt, saying the National Guard there didn't have to get their shots. But there was pushback yesterday from the Pentagon. Here's spokesman John Kirby.
One could elect not to take the vaccine, of course, but then you would be putting at jeopardy your ability to stay in the National Guard, which, as you know, is also a component of the reserve component in the total force. But as to the specifics of how that would play out, I would refer you, in this case, specifically to the Oklahoma National Guard to speak to.
So in other words, they'd be denied training opportunities?
They wouldn't be allowed to train. They wouldn't be allowed to drill. They wouldn't be allowed to contribute to operations under Title 10 or Title 32.
Now, anti-vax activists got some good news yesterday. The Missouri court there temporarily blocking the administration's mandate for healthcare workers in 10 states. So, Mr. Simon, I'll begin with you. Why would healthcare workers who are on the front lines in constant danger of being exposed or getting sick, why wouldn't they want to get the shot?
Well, one, you have the conspiracy theorists out there that are creating a number of schisms regarding vaccines. Two, you have religious exemptions or people seeking religious exemptions. I was reading this morning in the Wall Street Journal that actually there are some cell lines from aborted fetuses that are being utilized in the creation of the COVID variant vaccines. Now, I haven't verified that beyond what I've read. The government's obligation to provide health and safety to its citizenship should override that. But there are some interesting constitutional arguments coming out of the resistance to the vaccine mandates.
So, Joteka, 9 out of 10 states suing the Biden administration for its vaccine mandates, all red states. Should governors have the right to override the federal government if it means it is costing their constituents, their voters, their lives?
Well, of course, states have right to, voice their opinion. But let's look at the situation here. Again, these are all Republican states. This is really a politicization of what's really happening in the country. We know right now with the onset and the discovery of the Omicron variant that this is a serious public health crisis in our country and in our world. And the last thing that we need is for this to be a political argument about whether or not people should get what science has really showed us, that the vaccines help prevent death. It helps prevent the transmission of this, and it really helps anyone who transmits this virus to have the ability to live. And it's just really sad to see that there are so many Republican governors who want to fight what we know is science, is that vaccines actually work. Further, what I will say is that, it was referenced in this segment, is the conspiracy. What we saw when the vaccines came out was a large spread of misinformation that has really in so many ways tainted a lot of Americans and scared them away from this vaccine. And we actually have to make sure that people get the correct information and people have access to these vaccines. And we actually need to take the politics out of what we know is science.
Mr. Simon, 30 seconds left, but why shouldn't the Democrats blame the Republicans and say that if not for your hesitation, if not for your anti-mask orders, your anti-vax orders, this country might have achieved herd immunity and been in a better place now than it is? Why not point the finger where the finger needs to be pointed?
Well, I think we will hear that as we get closer to the midterms. But I'll also say the overall messaging of the coronavirus and the COVID vaccines has been problematic. I think obviously with the last administration, it was totally off the rails. But even with this administration, maintaining a consistent message on who's obtaining herd immunity, what are the actual ingredients of the vaccine. I am fully vaccinated. I have the booster shot. But I will say, just as an objective, observant of the messaging, that it is problematic in my view.